So I wanted to clarify a few things about facelifts. So there are many different techniques out there, but the two that I think most people are aware of right now and are the most common are a SMAS lift and a deep plane lift. And they're actually very similar. A SMAS lift is when you take the deep layer in your face, which is called the SMAS, which is contiguous with your platysma, which is this muscle here. So this comes up onto the face and it actually envelops your entire face and turns into other layers up into your forehead and over your entire cranium. But that layer can be tightened. So you can either plicate it, meaning put stitches in it, or remove a little bit and pull it and tighten it. That's considered a SMAS lift. That's been around for a very long time, and it's probably the gold standard for facelifts in general. The deep plane lift is just a variation of the SMAS lift. We're taking the same layer, but instead of just plicating it or pulling on it, we're actually dissecting it up anteriorly. So we're going forward into the face until we get to this more anterior cheek area where the skin tends to be loose. So when you do that, you can release some of those tissues and you can pull on them a little bit more vigorously and get more tightening of the jowls and the nasolabial folds. It's a very powerful technique. It works very, very well. It's become very popular, though it has been around for over 30 years. The results are quite good, but it's not necessarily a procedure that everybody needs. If you don't have a lot of laxity here, a deep plane lift may not be the right choice. A SMAS lift is probably fine. The deep plane lift has slightly increased risks too, so that's one thing to consider. There's quite a number of nerves in that deep plane, and they can get injured. Even the best hands, they can get injured. Injuries usually are temporary, and they recover over weeks to months. But if that were to happen to you, it can cause some anxiety as everything is sort of settling out and rebalancing. In either case, one of these two surgeries is probably best for you if you're actually considering a facelift. But the best way to know that is just to come in or see your surgeon and ask which one makes the most sense. Any surgeon who does just one technique on everybody probably is not the person to go to. You really want someone who knows different techniques and why each technique would be best for each given patient.